The following instruction video shows the best technique for injecting with the BD AutoShield Duo 5mm pen needle. These instructions are common to all insulin and GLP-1 pen devices. If you need any further information on any specific pen devices, please refer to the pen manufacturer's instructions for use. Firstly, inform the patient and gain consent to give the injection. Wash your hands. Check the injection site prior to the injection. You must avoid injection into any sites which have signs of lipohypertrophy, edema, inflammation, or any signs of infection. If you need to cleanse the injection site, do so with soap and water and a clean disposable cloth. To avoid the development of lipohypertrophy, you must always rotate injection sites and try to spread the time between injecting into a single site as much as possible. Protect yourself as much as possible by wearing examination gloves and, if necessary, safety glasses prior to giving the injection. If the insulin is of cloudy or premixed type, you must fully resuspend it prior to giving the injection. To resuspend insulin, gently invert the pen device through 180 degrees 10 times and then roll the pen between the palms of your hands 10 times. Do not shake the pen device, this will cause the formation of air bubbles. Select the BD AutoShield Duo pen needle. Check all the packaging is intact and the use by date is valid. Remove the paper cover like so. You must bring the pen needle and pen together in a straight line. Applying the needle at an angle is to be avoided as it might cause the cartridge rubber septum to tear and lead to some leakage of insulin. Screw the pen needle onto the pen device, but be careful not to over-tighten it, as this makes removal more difficult. Now remove the cap. Now it is time to perform the test dose. Set the dosage dial to 2 units. Turn the pen so that you can clearly see the pen needle tip, but make sure the tip is pointing away from your face and eyes. Wear protective glasses if necessary. Press the dosage button. You should see a few drops of insulin appear at the tip of the needle. If not, repeat the test until insulin appears. Drops of insulin at the needle tip will confirm the pen is functioning correctly and that the needle is patent and working normally. Now select the dose prescribed for the patient by turning the dial. With the dosage set correctly, you are now ready to give the injection. Performing the injection without a lifted skin fold. This is the recommended technique for the BD AutoShield Duo 5mm safety pen needle, except if there is a concern for a potential intramuscular injection, or to create a firm surface in order to perform the injection. Dial the prescribed dose on the pen. With the pen held in your fist and your thumb away from the dose button, position the pen at 90 degrees to the surface of the skin. Slowly and deliberately push the needle through the skin and into the subcutaneous tissue. Keep your hand position stable throughout the injection. With the needle in the tissues and the guard fully retracted, move your thumb to the dose button and slowly and deliberately inject the full dose. Throughout the injection, observe the needle and guard for correct positioning. Ensure that accidental guard deployment or needle retraction from the skin has not taken place and the needle remains in the correct position in the tissues. Now that the dose has been fully administered, count backwards from 10 to 1. This gives sufficient time for the full dose to leave the pen needle and be deposited into the tissues. With the dose administered, carefully withdraw the needle from the patient's tissues, keeping the pen at 90 degrees to the skin surface. You should be able to see that the red guard has now been activated and covered the needle tip. Performing the injection with a lifted skin fold. This is the recommended technique for the BD AutoShield Duo 5mm pen needle, or if there is a concern for a potential intramuscular injection or to create a firm surface. Form a lifted skin fold using your thumb, forefinger and second finger. Lift only the subcutaneous fat. Take care not to lift muscle tissue in the skin fold. Try to keep your fingers and thumb at least 25mm apart. This will minimise the risk of accidental injection into your fingers or thumb during the injection procedure. With the skin fold lifted, squeeze firmly to ensure that the lifted tissues are firm. Do not over-squeeze so tightly that you cause blanching of the tissues or discomfort and pain. With the pen held in your fist and your thumb away from the dosage button, position the pen at 90 degrees to the surface of the skin. Slowly and deliberately push the needle through the skin and into the subcutaneous tissue. It is important that you continue to keep squeezing pressure on the lifted skin fold to avoid accidental deployment of the pen needle guard. Keep your hand position stable throughout the injection. With the needle in the tissues and the guard fully retracted, move your thumb to the dose button and slowly and deliberately inject the full dose. Throughout the injection, observe the needle and the guard for correct positioning. Ensure that accidental guard deployment or needle retraction from the skin has not taken place and the needle remains in the correct position in the tissues. Now that the dose has been fully administered, count backwards from 10 to 1. This gives sufficient time for the dose to leave the pen needle and be deposited in the tissues. With the dose administered, carefully withdraw the needle from the patient's tissues, keeping the pen at 90-degree angle to the skin surface. Then release the lifted skin fold by separating your fingers and thumb. You should be able to see the red guard will now have been activated and covered the needle tip. To remove the used needle from the pen, hold the pen in one hand and point the needle away from you. With the free hand, move from behind the needle and take the needle in a firm grip between your finger and thumb. You now need to unscrew the pen device from the pen needle. Take care, the pen needle rear guard will activate and you will feel the needle spring forward when the needle is fully unscrewed. You should now be able to see that changed geometry on the back of the needle. The orange guard will be activated and cover the back end of the needle tip. Carefully transfer the used needle to the sharp disposal box, which should be near to hand, and drop the pen needle into the sharps box from about 5 cm above the opening. The injection is complete. Safely remove any unwanted drugs and safety equipment from the patient's vicinity and make the area safe for activities of living.